Hello, everybody. What's going on? Who do we have on there? We need a sound check.
Hi.
The three of us are here. Oh, shush. Okay, we need a sound check. Where's everybody watching from?
It's a little dark in here.
Did I do it backwards?
No.
Oh. I think we're good. Hi, Debbie. Hi, John. 6 people. Sound check, please. Today's all about the back. Hello. All right. We got 9 people on there.
Sound is good.
Sound is good. Cindy wants to join us on our video. Hello, hello. Kansas City,
Oh, fun.
Bethlehem, my mother. John, all right.
Thank you.
Mama. So as a point of interest, the electrician just went to my mother's house and baby, Beth, hello. He is going to wire that. She's got a 100 amp service and he says she's got enough juice in there and he's gonna run it 50 amps for the Therapeutic D. He's not bringing more amperage in, which is sort of interesting. Captain with the photo bomb. All right, Hansville. Cindy, how are you? David, Texas, awesome, very cool. So let's see, we'll give everybody another couple of seconds here. Sue, good to see everybody. Now we're somewhat normal live in our own place, although in 2 weeks we're not sure what's happening with that one either. We're at a dealer meeting and we're not sure what's happening with that one.
We're not sure if we'll be back in 2 weeks or 3 weeks. We will keep you maybe not posted. We'll probably just.
We have not been told yet either, if that makes you feel better. Okay, and that's it. All right, so we'll talk about this a little bit while a few people hop on. So normally with our lives, if it's all about installs, people love that. They love to see the pictures of installs. They love to talk about it. There's always a couple knuckleheads that, don't say anything but how much, and we have no idea what they're talking about. That's always fun. That's normal. And then whenever we do an exercise-based live, it never really gets all that much traction. And that's sort of interesting because most people sort of talk about the exercise that they're doing in here, but maybe aren't serious about doing it for the most part. But we know that some people are mega serious about it. But I'm talking about, generally speaking, if you look at the masses and all that. So, and that was always the case until we did our amazing knee focus live. And that one had the most traction out of any exercise video that we ever did. And I think I know why, but it's completely theoretical and I just think that. So how we did that was, it was personal for us because that was something that we're both doing and dealing with after years of Ironman and running and all that. Mine in particular, Mary's I think are fine, but my knees were aching after running and I sort of stopped running. I stopped running and now I'm running again, not like I used to, but I've got no pain afterwards. So the knee strengthening stuff really actually worked and we were focused on that personally. Well, this stuff also hits today. So the next thing, and none of us are getting younger, none of us can escape that, is the back stuff. Now, before we start, there's a million reasons your back can hurt, okay? It can be serious, it can be not serious, it can be just you need to move more, it can be, something you're not even thinking is your back. Certain places on your back can be, horrible things that have nothing to do with your back. So if, I have to say this, and the thing is, I actually mean it. It's not just like boilerplate, garbage to say,
Oh, yeah.
if you've got something going on, you need to run it by your doctor.
Yeah.
Okay, because there's, like I said, there's a million things that cause back pain, and this is only sort of one focus on that lower back pain. Okay, but it's in a little different direction. I hate, and everyone hates it. Got to strengthen your core, and we're gonna do a little bit of that, but it's just.
Yeah.
I hate it's like it's the answer for everything. Well, it's not quite the answer for everything.
Yeah.
It's the answer for some stuff, and obviously you need to strengthen your core and you need to be strong in that way. But it's not the end all be all to everything that can possibly happen. And this is something that is uncommonly known about today's focus, which is the psoas, which is a muscle that goes from your spine, hangs around your pelvis, and then ultimately to the top of your femur. And it's basically the front muscles. You have SI joint, you have your psoas, you have a lot of other stuff under there that cause back pain and no real way to work on it. Is he being fresh?
He's like running around behind the hot dogs.
He's okay.
Okay.
So that's and then the other thing that we think worked with the knee episode was that we sort of did a list.
Right.
You know, we wrote a list for specifically, you know, your knees and strengthen them, an actual sequence. And we did the same thing today for back. What is the best way to cool your spot during the intense summer heat? Seems a little bit out of place for the workout episode right now. Why don't we get back? We'll circle back to that, okay? And we'll get there. So today's focus is on the back. Just leave him alone.
He's sniffing around.
Who cares?
Yeah.
I don't care what he does. Just leave him alone. If he's quiet, that's fine. So that's what we did today. If you want to see that, you want to grab that card, Mare?
Sure.
All right, I'm spinning around on you. Because if we don't, it'll come backwards. Can you hear you? Patricia, I can hear me. I'm not sure that's what you meant, though. Okay, hold. All right, we'll hit that again. Oh, that's a lot. You might need to screenshot that, but that'll work.
Yeah.
All right. That's what we're doing today. And this is basically, for the most part, what we are doing, me specifically, what I'm doing for my back, so that I can, basically the symptom that I'm having now, I can hear you, thank you. The symptom that I'm having is after I run, my lower right back is like super tight. I can definitely feel that it's muscular, and that's what this is really focusing on, is when you have muscular situations going on causing back pain, which I know that's what I've got going on, and it's all tight psoas and hips and everything else. So that's what, you know, genders tend to have the same tightness things, same spots. You know, men will have things go on that most women don't have, although that's certainly not the rule, but it is common. But this stuff will be universal and will work really, really well. And there's a lot of stretching, a lot of strengthening, and there's a lot of, you know, we're actually going to use the swim jets for therapy in a way that even we have not talked about before. We've talked about it, but never shown it like this. Okay? So, you want to start, Mare?
Sure.
What do you
You're
want?
going to do the
Yep. Okay, here you go.
VSPs. So Ben's going to show us how to use the VSP jets, or even this is a Challenger 15.
Yep, so on the Challenger, we obviously have 6 jets, and on the Trainer 15, hello, Mary, just stop thinking about the dog. You've never done that before. Leave him alone, let him be fine. You've got 6 jets here. On the H2X, you have 4. So for my height, it's the middle 2 on here that work. That's VSP 2 on the Challenger. So you can go over here and just turn on VSP 2 alone. And I will say this, that we're going to focus on using those big swim jets for therapy, and you want to hit the front. You can actually, for me, it's shaped perfectly. I can hit both sides, both psoas at the same time with the 2 jets that are right about there. And then the next thing we're going to do is low back also in there. And for the video purposes, we're only going to do it for a minute or 2. But normally, a lot of times, I'll do this just that with no exercise, and all I'm doing is getting that soft tissue work, that therapeutic reaction from those big, strong jets. But for my height, it's VSP 2. If you're a little lower, a little higher, you can, you know, tippy toe a little bit or hunker down a little bit if you're taller, or use different jets. You don't have to do both sides at the same time. For me, it works out perfect. So let me turn that on. VSP 2. Now normally on your psoas runs down like this, and you can get both at the same time, and they're sort of deep in there. So what I want you to think about is, you know, for me, I put the VSP on 20, and it's a lot, and it's really getting in there. I just put it on 13, you know, just for the video purposes. But you can see these two jets are right in the right place. And it might look a little funky, but all you're gonna do is move around top to bottom. So if you're really serious about this, you may actually wanna look up a picture of the psoas and see how it goes. And it runs up and down. It's about that long on you know, your average height person. So you wanna move up and down. This is the same thing if a therapist ever told you to roll around on a ball or a soccer ball or anything like that. We're doing the same thing. This is soft tissue work like a massage, except that it's not as uncomfortable. But I will tell you, if you ever have someone work on your psoas, it is terribly uncomfortable if it's tight. Have you ever had that, Mary?
No, not like you. Yeah.
I mean, she had me in tears from
Yeah.
it. It hurt so badly. And she was not like using an elbow. It was
Yeah.
a thumb, and it's just uncomfortable. And mine are very tight, and this is how you're gonna do that. So you're just gonna stand there, you get both. Watch your goodies in there when the jets are on 20 on VSP. You have to be a little mindful of what's pointing where. I'll just say that. Okay? Up and down. You can twist a little bit. Get nice and close, nice and strong, and you'll feel it. If you feel any discomfort, I don't want to say the word pain because it's not like having someone actually dig their hands in. You're going to feel some pressure, but it's not going to be nearly as painful as if someone was doing it manually, which is sort of nice, but it still works really, really well. And you can do this for 10 minutes. Consider this part of the warm-up for the workout that we're doing right now. So you go up and down, move around. So it's feeling nice. Then I want you to turn around. Second item is low back. And I use those same two jets. So if you look at the way your muscles come down your back, those two jets are perfect. Now my knees are bent and I'm working it up and down into the top of the glutes. Mary brought up another point, you know, as far as the SI joint goes and your piriformis muscle and sciatica, all that stuff. You really sort of need to focus on the glutes, and let me tell you, these jets are strong enough to get in there, okay? And you can just sit there and get all that stuff, but like I said before, there's a million reasons your back can hurt. This is among them, and it's all of your hips, your low back, psoas.
Well, I get a lot of low back issues from just stupid things like sitting on the plane and just some certain exercises. I'll get some pretty uncomfortable back tightness, and a lot of times it's stemming from glutes and hamstrings.
Right.
And so even though the pain is, you know, specific to the low back, it's stemming from tightness, you know, in those other areas.
Right, and what's interesting is that for years, Mary and I have been racing and running together, and when we run, I get sore quads and she gets sore hamstrings, which means she's a better runner than I am form-wise, but just that's the world we live in. So all that stuff can cause back pain. So we're going to focus on the soft tissue work around your midsection, not just the core, around everything. And these jets will get in there. So I did the front, the psoas, now I'm doing my lumbar spine, all the low back, I'm hitting my glutes, the top of that, and I would turn this up more than 13 because that's not, in your glutes are the biggest, thickest muscles in our body. It's not going to get in there unless you crank it up. If you need to, you may find that you have to, like I'm bending my knees and bracing myself against there, and it's working well, I'm going to turn into it. So the next thing, the third thing on the list is, and this is one that I had not tried before. I did the front and I always do the low back. I never did the sides. And basically what you're doing is getting your whole entire trunk with those jets. And all we're doing is warming up, soft tissue work. And you want to do this. If you do this for 15 minutes in there with that thing turned up, you are doing yourself a tremendous favor. So we actually need to get you to try it like this and actually spend the time. The trouble that most people have is that as a whole, we're always in a hurry. And when do you take 15 minutes to just sit here and do this therapy? Same with stretching. Stretching is one of those things that's often overlooked.
Yep.
This is going to fall into that same category, which is why we did it in a list that way. So now I'm just going to rotate around, and I'm going to get every nook and cranny glutes, low back, hips. You can get into that hip joint nicely with these jets because they're so freaking huge and powerful. And I don't care what kind of a hot tub we're talking about, nothing is going to have the capability of these swim jets for specific therapy. It just doesn't exist. You're getting that whole pump out of two massive jets that are right there, and you have a handle to hold on to. It can't be better than this. Okay? So we're spinning around. If you need to get closer, it's a little harder, or you can just turn it up. And I'm just getting everything. Sides, hips, glutes, back, front, psoas, everything. Just warm it up. Okay? And you should take, 10, 15, I don't know if you need 20, that's a lot in there. But certainly if you were having pain, 20 might be good. Okay? So now we're all warmed up. What's next? I forgot the list.
Rows.
Okay. Ooh, I gotta connect those.
Yep. Actually, that will be a good thing to show.
Yeah. All right, Mary, they're right behind you. Mary's gonna put the rowing bars on.
So for the row bars, you attach one of the resistance bands
Want me to get up close
to
in
the
there?
clip to the
So that's
band
the
around.
short one.
and one clip is going to go on that, and then there's like a little button that the end of the row bar goes and it
Snaps
clips
in.
in. We've had a lot of people mention that sometimes this button doesn't push in when you want to get it out, and sometimes there's silicone from production in there, and
Yeah,
you
and
just
it
kind of have
slides.
to get out, and it slides.
Yep. That one works like butter.
Yep.
But you can get some silicone in there, and that's pretty common and normal.
And you just have to kind of rub that silicone out so that you can easily slide that button.
Okay. We'll show it again while we're here. Go ahead.
Clip.
I'll
Nice.
take the band. Oop, you're pulling.
Oh, sorry.
Don't let someone pull on the row bar before you get it connected. Okay, so I am not tall. Actually, I'm going to turn this VSP off for sound. Or down. Oh, hang on. There you go. VSP2, low. I'll just put it at 5. Okay, so what I do on there is I put my feet, see where Mary's got her feet right on the Master Spas logo?
Yep.
And then I know that I can't sit all the way down at my height.
I don't sit.
And I know if I'm not, Mary's definitely not. So what she's doing right now, and she's not saying it, but I know what she's doing. She's got her legs are flexed and they're holding her in place with her feet down there. Okay, and then she's gonna row. So next on the list is rowing for 2 minutes. And what we're doing is we're just loosening up your back. This is not a bodybuilder's workout. This is for back health. This is for some strengthening, flowing blood so that you feel better. Look at your little admirer. Okay? Now what you want to do, and I sort of wish I could turn her around so you could see that. Pretend Mary was facing the other way, and I put my hand like this in between her shoulder blades. She's trying to take her shoulder blades and squeeze someone's hand like that. And that's the motion you're looking for to do these right. You're trying to squeeze those muscles together, and you're flowing blood in all those muscles that otherwise, if you don't do an exercise like this, you're never gonna move them in that way. So it's pretty huge, okay? All right, so I have on there 2 minutes, and we'll hold that list up again. And now there's no wrong answer here. You can do it with your hands under the water the whole time. You can go, above like that and squeeze, and then you can do it any way you want to. There's no wrong answer. All right, we're not bodybuilding here. We're flowing blood through all these muscles that need more movement and more blood flow. Okay? How's that feel?
It's good, and I'm focusing on squeezing and almost stretching those muscles.
Yep. And then you're also stabilizing yourself there.
Right.
Which we have to do because we're shorties.
Well, that's good core. Core.
I mean, aren't you sick of people, gotta strengthen your core? It drives me nuts. I hate when they're,
But I mean,
it is true. I know it's true, but I'm tired of it. And there's other ways we can focus and say it. Then you gotta strengthen your core. It drives me nuts. All right. Okay, let's stop that. What's next? What's next on the list, Dr. C?
Core rotations, 15 each side with the kickboard.
All right, kickboard.
All right.
That's you. I'm gonna give you a little more juice. Yes, it's at 97 degrees, and it's awesome.
It is.
I'm gonna put 10 on the board. Okay, so I'll move out of the way. So what's happening now? VSP2 is on. Slide down, 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 down. It sounded like a person. Back up towards the wall. Nope, there, that way. Okay, you gotta stand. What are you, right there. Now you're holding this sideways to catch the water. Okay. Now it's awkward with the kickboard. So however you wanna hold it, I think top and bottom are probably the way to go. And hold that like that, which is gonna require, are you floating away?
Strong, yeah.
Okay, here, let me do it, we'll switch.
Yeah. I'm too short.
I have it on 10, so that might be too much water for you
Oh,
because.
sorry guys, I just made everyone dizzy. For me, I can't get good traction, so it's easier.
So this wants to shoot out of the water. Oh yeah,
Yeah.
I'm working there. So this wants to shoot out of the water. Mary is 4'9.5", and then when she's holding this down with that on 10, that's too much. So we would have to turn that down so that she's not being pushed out of the water. Obviously, that's not the goal. So you want to stand like 3 feet, maybe 4 feet off that wall. I've got just VSP2 is on 10, okay? And I'm going to hold this, and I'm going to rotate. So right now, my feet are shoulder width apart, just like that. I don't know if you can see that. And my knees are slightly bent, and I'm locking myself in place. A couple of forces in play here. One is that we want to float in water. This guy is trying to drag us that way, and I don't want to twist my knees and my legs. I want to lock my midsection, my core, facing that way, 90 degrees from the jets. And I'm going to use this to catch that water, which it's hard.
Yeah.
Okay? So you want to come all the way down. I'm twisting as far as I can in my trunk only. I'm not moving my legs at all, and my feet are not. And then I'm going to come up nice and slow. Wow, that's hard. Now that whole time I'm flexing my stomach. All those muscles are flexed. And you can hear a little strain in my voice. It's harder than it looks. Okay? You can do this if you have dumbbells. You can use those. You can use the kickboard. You can use your hands. Okay? You can use nothing. Just like that. Not moving your feet, you're just twisting. 15 each side. That's hard. I need to actually turn it down a little bit. Because it makes you want to move your feet.
It does, yeah.
So next thing, we're going to do the opposite. This side's more natural for me, so it feels better. Although it's hard. Right when you're at 90 degrees. Now I've got that kickboard is right in there against that VSP on 10. It's only VSP2. That's hard. I might have made it too hard.
Sue, yes, we do have the diverter valve fully towards the swim end, nothing on the seats. And then basically you can just adjust the...
Between the 97 degrees and that, I'm starting to sweat a little bit.
And then you can just adjust the speed.
I'm a trainer. You can just adjust the diverter away a little bit if you need to lower that down. You don't need a lot on there.
Someone said that the twisting is harsh if you have any disc problems.
Absolutely.
Yes.
Absolutely. So that's the whole thing. We're in water. If anything hurts and you know you have a reason not to do this is why I said before, if you've got anything going on, doctor is always first. This is just exercise in the water. Okay, we are not prescribing physical therapy for a specific injury.
And this is all for betterment, to make you feel better. If anything is uncomfortable, then you should definitely not do it.
Obviously. Okay, what's next?
The next, let me look.
Knees to chest?
I think it is, yeah.
Can't remember.
We'll do a quick look back if anyone needs to take a screenshot. Here is our list. We just did core rotations. Next we have knees to chest swim side, and then flutter kicks.
Okay. You want to do this?
Sure. We'll switch. I'll try not to make anyone dizzy.
Okay. So. All right, so now what Mary's gonna do, she's gonna cross her ankles, all right? And she's holding onto that bar. Now she's got the VSP, right now I didn't change it. You can make it as hard or as easy as you need to. Now she's going to keep her legs pressed together so that water cannot escape in between them. And she's gonna pull knees up to the swim jets. And that's going to give you resistance. And you wanna go nice and slow and deliberate and really kind of focus on flexing those ab muscles while you're doing this, so you're working in there, okay? So right now this is a strengthening movement and an abdominal strengthening movement, and it's actually one of the things that drives me nuts is getting down on the floor to do stomach. I like doing it, if anything, hanging. I like to do that. I like to do this. I don't know, I've got some kind of a thing. I'm not afraid to get on the floor. I just don't love it when I'm working out for some reason.
I also think that the reverse motion out, pulling your
Absolutely.
Legs out to, extend
Yep.
is a good stretch
Oh yeah.
for the back.
And you're actually getting some psoas stretch in there as well.
Yep. So those are really good for a variety of.
Hi, Kim. Kim hopped on.
Okay.
Mary, did you love Elizabeth said people tease her for keeping it 98
Yes,
and you loved it? I'm looking through the comments here. I love it too. Ours is hot.
Yes, and my feeling is if it's warm enough that you want to get in and you want to exercise because it's a good temperature for you, then keep it at the temperature that you like. It will definitely help you to stay motivated.
You mean if this was freezing cold, you
I
wouldn't?
wouldn't get in.
You wouldn't be motivated to get in here?
Absolutely not.
Yeah, me either. Good for you. All right. So again, pulling knees to chest against the current.
Flutter kicks.
Flutter kicks are next. Now these flutter kicks, they can be done facing up or down, okay? So all you're doing is you're trying to lock your body straight like this, and then only, never mind that thumb, just do this with the legs, and your knees are not bending, okay? It's all coming from your midsection, and you can do them short and rapid like this, or open, and if you want to kick and make some noise, you can do that. You can also, if you're agile enough to flip over and hang on to that bar, you can do them underneath. You gonna try that, Mare?
Yeah.
And then hold yourself out as far as you can while also holding up. And you can do it at whatever angle is comfortable. And you want to do this, like a good 60 seconds on this. Okay? Lisa agrees. I agree, Mary. I don't get into any cold water for any reason. Heck yeah. We're in the business of hot water. No more cold water, Lisa. I'm with you. Unless they make me do it, which they do seem to all the freaking time. Hey, Ben's coming to get in the swim spa. Let's make it cold. He loves it. All right. Perfect. Flutter kicks, 60 seconds. Make them hard. All right. We'll go back to the list. What's next? Okay. Now it's going to be a focus on stretches. Okay. That's what you're there for, Ben. I know. We all know. Everybody knows. That's cold water. Ben will love it. He'll get in there. Actually, Mary has done her fair share of cold water as well when we have to. So she will get in if she has to. All right. Once in a while, we have to do a gut check. Okay. Next, hamstring stretch. Let me bring that list over here.
Turn the VSP off.
Yep, you can turn it off. Oh, well, hello there. You look like Batman with your ears. Okay, so hamstring stretch. You wanna hold that?
Sure. Ben's turn.
Back turn. So hamstring stretch, there's a million ways you can do it. Whatever way works for you, but you need to do it, okay? What are you, I see you
60 seconds sounds better than 1 minute.
It does.
Very true.
It does. So how I do my hamstrings in here, I do one leg at a time. I put it up on that second step and just reach for my toe. Simple, both hands. Some people, you're not gonna be able to bend at all. Some people are gonna be super flexible. Bend to whatever your level is, okay? If it hurts, stop. I shouldn't need to say that, but I'm gonna say that. And you're stretching that hamstring. And what I want you to do is you should be pretty warmed up now, okay? And by the time you get there, let's say you first stretch, you can't quite get to your toe. Do it for 10 minutes each side. This should take you a long time to go through. It doesn't have to be terrible, but it should take you a while to do it right. And this kind of flexibility and strengthening is the reason we feel old. Fair to say?
Yep.
Fair to say. So, are you staring at? I love you too, buddy. So you want to hold this for a few minutes until it loosens up, and you should see an improvement in the course of 5 or 10 minutes, especially in the warm water. When the water, and we talk about this a lot, we're not swimming, Olympic swimming at 80 degrees. We have nothing left to prove. The most perfect temperature for doing this kind of stuff is 91 to 93 degrees, which is the temperature of the surface of your skin. And you want to focus on that. That's where your ligaments and tendons are most pliable and muscles feel great. Anything above that, you just need to be careful you're not too hot. But now that it's getting to be winter months, if you're outside, most people tend to keep it on the warmer side. I know ours is probably, I think Beth could confirm that for me. I think we're 96 or 98 right now, unless she turned it up, which she absolutely might have. Okay, look at that face. So you're gonna stretch, then you're gonna switch feet and do it again. So much of our back pain is caused from tight hamstrings. In fact, one of the things that they test for young police officers, which they do a physical fitness test, which is harder than most jobs. Obviously, if you're an HR manager, they're not doing a physical fitness test. Or an electrician, they're not doing any of that stuff. But for police officers, they do. And one thing they've always done is what they call a sit and reach. And they've actually figured out that the more flexible your hamstrings are, the less likely you are to have a back injury while basically sitting in a police car for 25 years. Because it's very terrible on their bodies.
Beth has turned it up to 100.
Perfect. So, both hamstrings, and just do it until they loosen up. Do a good job. This will make you feel better. If you did this every day for 2 weeks and actually, jotted down how you felt in a journal, just by stretching your hamstrings on a regular basis, your entire body, hips and back will feel way, way better. Okay? What's next?
Maureen says that if you exhale while stretching, it can help relax the muscle more, and that flexibility more than strength prevents injury. I agree with that, yeah.
Yep. But we cannot discount the combination.
Of course,
both.
yeah.
Okay. Now, for hip stretches, my right side is terribly tighter, much more worse, terrible, horrible than my left. So this is one that I use, and it fits me perfect to sit in the edge of this back seat. Okay, or I'm sorry, where you go right in there for the rowing, and then if your hips are tight, when you put that right ankle, like you were just chilling out, on that knee, then you want to press this knee down, and that's going to tighten that, or flex that hip, or stretch that hip.
Here, you can see this a little bit better.
Mine are terrible. That is uncomfortable for me, and I am not a picture of perfection here. I am fighting the same battles you guys are. Some of our battles are worse than others. My hips and psoas are terribly tight. Years of weight training, years of running without enough stretching. Okay, and it's the first thing. If you're busy, people tend to cut it out, and I am also guilty of that. Switch legs. Now I can sit with my left up here, no problem. Actually, no, it feels tight today. So you want to press that knee down. You can lift this foot up by lifting that knee, and you're going to stretch both of those hips. So it's if that's too tall, or too, if you're not tall enough for that, you can sit up on the higher seat and do it that way. And then you can even stretch forward, and it all goes into that hip. but that's the easiest way to get that nice stretch in here. And for me, the temperature of the water is going to loosen all that junk up, really makes the stretching more comfortable. What do you think, Mary? I mean, more effective, more comfortable, less possibility of injury, and just
Yeah. Well,
more,
and
more fun.
the temperature too
Yeah, the
really
temperature
does
is
help.
huge. It's just if it's terribly uncomfortable, we tend to not do it.
Sure.
And this is a great way to do something that for me is uncomfortable, and in here, I enjoy it. All right. Okay. Now, what's next? Psoas stretch. Okay. So again, that psoas is in the front, goes from your spine down around your pelvis, and then attaches to that femur. So how you want to stretch this, I might have you do this, man.
Okay, just tell me.
Yep. So what you're going to do, and you remember this, come on over here and put your front foot, try that second step right there. And as you guys can see, we're sort of, I know how I would do this, but I don't know how Mary would do it, so we're playing with this. Bend that right knee. Now what you're doing is basically like a one-legged squat, and you want to stretch forward. Okay, so that back leg is straight, and tell me, is that a better spot?
This just gives me more of a stretch.
Okay. And you want to stretch all that junky front. Yeah, Carol said best place to stretch papas, and then she corrected psoas. Damn autocorrect. Okay, so in all your stretching, I wish we could get on the other side of that. All that junk up in front, and that's what you want to stretch. And then if you want to lean into it, again, the exhaling, I'm not a yoga instructor, although if you were taking yoga, you'd be breathing through all of these stretches, and it works. So I'm more gritty.
And then just go to the other side.
Go to the other side, however you need to. Back leg is straight, and it's uncomfortable. But I will say, doing it in here versus dry land is way more comfortable.
Yeah.
No question about that. All right, how's that feel, Mare?
Good stretch.
Good stretch. Okay, come on out of there. Now there's one last thing that's optional. So for me, I'm not a chiropractor, I'm not a doctor. We've given the boilerplate, if it's uncomfortable, call your doctor, all that stuff. Okay, but for me, when I crack my back, it feels great. So and I'm not necessarily trying to crack my back, I'm really stretching, a twist stretch. So if you lift your right leg, left arm over, you guys know where this is going, and twist, okay? If you know you have destroyed disc, bulging disc, ruptured discs, don't do this, okay? We're not recommending that. We're recommending a twist stretch. And if you happen to do all this stuff and get a nice hearty pop out of the low back, you'll find that you feel pretty great afterwards. For me, when I run, that's a measurement. When I run, my right low back tightens up, and if I go through and do this whole thing, and then I'll feel it because that back won't release, okay? And I don't have time to go to the chiropractor 3 times a week. It's not happening. We barely have time to pack our suitcase to the next freaking location, all right? So when I do that, I get a nice thunk out of my back, and it fixes things up, and I feel better immediately. And do that a couple days in a row after each run, or every single day that I run, I find that stuff is starting to go away. So with the knee exercise program that we did, which is the one that we're actually doing for us, that worked great. Knees are feeling super. And the only time I feel them is if I'm busy on a trip or something and I neglect some of those practices. And then the low back, this is the next thing to address. So, and this is all something that I've never been this age before. I've never been this tight muscled before. And as much as I'm trying to stay in shape and eat correctly, it's not always perfect. You know what I mean? We're all doing the best that we can. That includes us. And that's really sort of what we want to do here, is give you guys the workout. We'll hold it up again. One final shot on that.
Yep.
So this is for back health, back pain. One reason psoas could be causing back discomfort. Again, there's a million reasons that could be causing your back pain.
Screenshot.
This is just one. You got it?
Yep.
Okay. And that's it. Done.
So again, we are not sure, we'll come together here. We're not sure if we will be back in 2 weeks or not, we will be at a meeting. Where am I?
You're on.
Oh, I'm on. We will be at a meeting for Master Spas. So we'll kind of decide in the next week or two if we're going to do a Facebook Live, and if we are, we'll do our little blurb that'll be posted
Yep.
on Instagram.
So they might put us off. We might do something from the meeting.
And if
We have no idea.
Yep. If we are not here in 2 weeks, we'll be here in 3 weeks. So we will do our little blurb on the day before, whichever day it is. So
Very good.
Thank you everybody for watching us today. If you didn't get a screenshot, you can go back. We showed it a few times. I'm not very good at this. My arm is just not long enough. And we'll see you guys very soon.
Awesome. Thanks, guys. We'll see you
Have a good
in
night.
2, maybe 3. All right. Ciao.